Well, how's it going? It's been a while since I've made a video. We've been in school, lots of things been going on, but I've just been kind of pushed to the limit. I'm hoping this will relieve my anxiety a little bit. I plan a little bit of a COVID rant, mainly because I don't want to be accused of being a science denier. And there's just so many lies going on right now that I think it's time that we just stop, slow down, and look at a couple of facts. First of all, I think we need to look at some COVID facts. And these are facts. These are not opinions. This is not ideology. This is just straight up stuff. The number of deaths in the United States, you may have heard this, but the number of deaths in the United States during 2020, which you expect to be much higher, is really on par with the last 6 years going back. The data is out there. I mean, you can just go look at the data. And so you have to go, well, wait a minute, if we've had this COVID pandemic and if there's just been enough stress to shut down the planet, all of these COVID deaths, why isn't that showing up on the annual death numbers? Well, predominantly because other forms of death, such as heart attack, influenza, pneumonia, septicemia, cancer, etc., the numbers of people dying from those went down. Now, clearly, other diseases did not regress at a rate to perfectly offset the number of the COVID increase. The obvious explanation is that we're misattributing deaths to COVID. And so John Hopkins actually put out a paper on this. It was quite interesting in November. And of course, it got ripped down off of the website because it didn't agree with the political narrative. The PDF's still available. You can still go find it. But even without that paper, the paper pointed out some great stuff. But even without the paper, it doesn't take too much digging to just get into the data. You can find the data. Macrotrends.net has a great graph of just death rates over the course of the past 50 years, 60 years. Really good. You can just crunch all the data. And really, the death rate is proposed to be about 8.8 persons per thousand this year, which is what it's been really for the past 10 years. It's been on a slow increase. It started about 8.7. It's been going up about 1.2% a year for about 10 years. It's really kind of plateaued. It's a real smooth curve for the past 6 years. In the 90s, it dropped down to about 8.7. Prior to that, it was 8.8 in the 80s and the 70s. It jumped up to 8.9, kept going up in the 60s and the 50s. So really, the death rate isn't significantly different than it's ever been. And so with this, we have to go like, well, then the COVID death numbers aren't correct. But let's ignore that for the moment, that the COVID death numbers, they've been misattributed. Even with the numbers that you're using right now, if you go to the CDC website and you do the crunching, people under the age of 65 have a 99.99% survival rate if you get COVID. I don't know if you caught that number. It's kind of an easy one to remember, so let's try it. 99.99% chance that you will recover if you get COVID if you're under the age of 65. That's absolutely fantastic. And so really, that makes any argument about masks irrelevant because there's really no reason to flatten the curve. Now, you might say, wait a minute, hospitals are under a great amount of duress, and they are under a great amount of duress. The stress there is through the roof. But it's not because of a virus. It's because of administrative mandates that have to do with testing and with quarantine and with treatment options for COVID. And if you don't believe me, I mean, I've talked to lots of health professionals who are just in the thick of it right now. Go talk to somebody and ask them because they are under a lot of stress. They need a lot of prayer. They need a lot of support. But ask them if the stress is because they are seeing a severity and quantity of disease like they've never seen before, or if what's really going on is they're under an administrative burden that they have never seen before, that they're operating with skeleton crews because they're all out under 14-day quarantines, that they're having to do contact tracing every time anything happens, that essentially there's no beds left because there's no exit strategy out of a hospital. If you got COVID, if you test positive for COVID, you can't send a patient to a step-down unit. You can't go to a rehab facility or to a geriatric facility. Nobody's going to receive a COVID patient. So you have this one-way door into the hospitals, and there's no beds. So this isn't a virus. This is administrative actions that are pushing this pressure upon our healthcare industry. So that's just COVID. Those are stats. You can go look them up. Super easy. Now let's look at some facts about the quarantine, because you see, we have just spent a year or 8 months, 9 months living in an unprecedented time where we have quarantined the healthy. This has never been done before in the history of the planet. We're quarantining the healthy, and the effects of these actions are well documented. I did a quick search. I spent about 30, 40 minutes, and look what I came up with. The New American website reported doctors in California hospitals say suicide is outpacing COVID-19 as a cause of death. That was a report, but I can tell you that just locally, we've talked to funeral directors, and that's definitely the case in our county, that we have many more suicides, and that the number of excess suicides in this county far exceeds the deaths that can be attributed to COVID in the county. The CDC director, Robert Redfield, okay, this is the director of the CDC. He stated, and I'm quoting, "We're seeing, sadly, far greater suicides now than we are deaths from COVID. We're seeing far greater deaths from drug overdose that are above excess than we had as background than we are seeing deaths from COVID." CBS, definitely not a conservative media outlet, they reported suicides claimed more Japanese lives in October than 10 months of COVID in Japan. MSN reported a brief released by the American Medical Association in early July, this is obviously a little while ago, stated that they were greatly concerned by the increased number of reports from national, state, and local media suggesting increases in opioid-related mortality. Of course, there's much more data out on that now, but they cited in their concern, the AMA did, that they have seen an increase in overdoses in 35 states, and an increase in overdoses in 35 states. NPR ran the headline, child sexual abuse reports are on the rise amid lockdown orders. What's extremely disturbing about this is these are reports from children. These are children to hotlines. These are not reports through Child Protective Services. Those reports have plummeted because those reports come from outside the family. Reports from schools, reports from daycares, reports from the community about abuse in families. Those are almost non-existent because everybody's holed up in their homes. The increase in report is coming from the children from inside the homes. We have an increased stress across the nation, and we know that domestic violence did not drop, that it's going up. And unfortunately, the only people who can report are the kids themselves. This is horrendous. The New York Times reported, instead of coronavirus, the hunger will kill us. A global food crisis looms. This is coming out of a report from the UN Department on World Hunger. And they basically said this: the world has never faced a hunger emergency like this, say the experts. It could double the number of people facing acute hunger to 265 million by the end of this year. Currently, or last year, about 135 million people, which are saying are on the brink of starvation. We're not talking about hunger in terms of American hunger, where you don't get to choose what food you get. We're talking about people who are trying desperately to survive. This is real starvation. And they believe it's going to be increased by 130 million people, specifically, the UN said, because of the quarantines and the lockdown and the disruption to the food chains. There has been enough disruption to global economies that money's not being sent to the third world. I mean, it's extremely inconvenient for us in the United States, but let's face it, we live a very privileged life. The people who are being hurt most are the weakest, and those who are already on the brink of survival. And this is pushing 130 million more people into that condition. We've got on July 10th, so it's a little older. This is Yelp, where you go look for services. They reported that over 76,000 businesses in the restaurant, retail, beauty, bar, fitness industries, they were closed. And that of those, about half of those reported that they were closed permanently, that they're never coming back. That was back July 10th. Of course, it's gone way, way up. I know that I was talking with somebody in the legislature. Just businesses in New Mexico are in the thousands that have closed just in the state of New Mexico. And with that, the Center for Infectious Disease Research and Policy reported in the beginning of May that U.S. job losses due to COVID-19 are the highest since the Great Depression, with almost 21 million jobs lost at the time. And of course, that was way back at the beginning of May. We know that job losses are way up there. So with all of that, with the facts about COVID, with the facts about the quarantine, I'm going to make two statements that are probably going to be considered quite outrageous. I don't really think they're outrageous. I think they're very reasonable statements. Number one, the first statement: Quarantine is killing more people than COVID. There was a study, I couldn't find it. I had found it about a week ago, and I can't remember where I found it. But there was a study in Africa that, and the results of the study, the conclusion of the study, was that for every one person that they were saving from COVID, the lockdown and quarantine measures were killing 29. That's not far-fetched. We don't have preventative medicine going on. We've got an increase in stress. We've got an increase in suicides. We have an increase in drug overdose. We got an increase in alcohol and drug abuse. We have an increase in domestic violence. We have increase in stress and depression. And we're not getting the health care that we normally get. Food supplies are not going to where they need to go. We've caused an absolute global health crisis. And so I do not think that it is an exorbitant statement to say that the quarantine is killing more human lives than the COVID is. And the second statement I want to make is even probably going to upset more people, but I believe it's a reasonable statement. I want you to consider it for a moment. The COVID pandemic is a lie. Now, I did not say that the COVID virus is a lie. Of course, there's a COVID virus. But there's lots of viruses, right? Lots of flus. You can go through and a little bit of research, you realize there's hundreds of flus. And there's hundreds of viruses that can cause disease in people. And COVID-19 is one of them. But it's not a pandemic. Because when you correct, and remember the CDC came out a little while ago, and there was quite a controversy over it, and both sides kind of rattled on about it, because the CDC came out and said, look, we've crunched the numbers finally a little bit. We've been able to look at the numbers a bit. And really only 6% of the deaths can be attributed exclusively to COVID. And the other 94% other morbidities were included. Well, this caused a lot of people to go say what? Because if you watch the media, you get COVID, you die. I mean, it was just the fear mongering was tremendous. And so a lot of people got really offended at that. Other people saying, well, you're not listening to it right. What they're saying is that COVID exclusively only dealt with maybe 6%, but it caused the other 94%. Well, actually, when you look at the death tolls and the misattribution for these other comorbidities, such as heart disease, respiratory illness, influenza, pneumonia, sepsis, the deaths that are normally attributed to those anyway, those went down. And I'm sorry, but COVID did not cure those conditions. COVID didn't cure cancer. It didn't cure heart disease. Those numbers went down because we incentivized a diagnosis of COVID. CDC even, and the World Health Organization acknowledged that we gave a financial incentive to diagnose COVID. So they were misattributed. When you back those numbers back out, COVID no longer meets the criteria for a pandemic or an epidemic, for that matter. So what we have going on here isn't science. It's rhetoric. It's politics. And it's killing people. And it's destroying the future. I didn't even go into education. This has to do with human lives. It's killing people. I guess what's making me upset is that I have to counsel people every day who are in tears and who are in fear and who are falling apart. We are living like caged animals, and there's no reason. There is literally no reason. And and I'm sure there's going to be people who take exception to what I'm saying right now, and I people don't have to agree with me, but what I would like to see is some facts, because I just gave a bunch of facts. I didn't go into the ad nauseum. I didn't go into the detail. To be honest, I don't have a lot of time to go into the detail. But I'd be curious as to the hard facts as to why we need to be crippling our civilization and destroying the future of our children and killing people. This is wrong. It's evil. It's wicked. It needs to stop. Well, that's my rant on COVID. I don't know if this is really going to even get out. The last couple of videos that I tried to put out, there after a while, they were just getting locked up. They were getting locked down. I'm nobody, and I didn't have that many people viewing, but maybe I had a couple in the thousands, and then all of a sudden it just stopped. So I don't know what's happening digitally. So I don't even know if this word's going to get out, but maybe there's somebody out there that needs to understand that we're going to be okay. So here's my positive spin on this. You're a parent and you're worried. Pretend you've never heard COVID. Pretend that never came. You know what to do. You're a parent. You've been parenting your kids for how long? Years? Decades? You know what to do. Are you a mom? You care about your kids. You know when to go to the hospital. You know when to go to the doctor. You know when to keep them home from school. You know, you've been parenting and it's been working out just fine. Remember a year ago? Remember a year ago when you were sitting in church? And you were sitting in church and there was a cough over here and a sneeze over there and a sniffle over there and then a couple more coughs and then some more coughs and sneezes and sniffles and it was there was so much actually going on that it was distracting from the sermon. Nobody got up and ran out of the room. Nobody freaked out. Nobody had a panic attack. Why? Because we just said, well, it's flu season. And the numbers are like this flu season has got the same mortality as last flu season. This year has the same mortality as last year. It's normal. Just be a good mom, be a good dad. Teach your kids to wash their hands. If somebody's sick, quarantine them. But if you're healthy, get out there and have a great time. And if somebody judges you for trying to live a healthy life, just look at them and tell them that you're not a science denier. Well, that's it. So be blessed.